Living with hypermobile EDS can be challenging, but there are ways to manage it. Whether it's dealing with daily discomfort, navigating social and work life, or just finding a routine that works, today we're diving into what life with EDS, hypermobile EDS, is really like and how you can make it better. I'm going to go over these questions in this video. So one is, what are the daily challenges faced by people with hypermobile EDS? How does HEDS, hypermobile EDS, impact physical activities, work, and social life? So make sure to watch the very end, where I will go over the best strategies for managing symptoms and improving quality of life, and how can a support system make living with HEDS easier. Let's begin. What are the daily challenges faced by people with hypermobile EDS? The daily challenges people with HEDS or hypermobile EDS face are not just about joint pain or flexibility, although those are big parts of it. For many, it's things like chronic pain, that nagging constant discomfort in joints or muscles, frequent injuries from subluxations to sprains when movements can feel like walking on a tightrope. Fatigue, which is huge. It's not just being tired. It's that deep, bone-weary exhaustion that doesn't go away. Digestive issues, things like bloating, IBS, acid reflux, which are really common. And finally, everyday tasks like getting out of bed, cooking, or working, which can feel overwhelming when you're not dealing with all of this. This takes me to the next question. How does HEDS, hypermobile EDS, impact physical activities, work, and social life? For many, exercises can feel like a double-edged sword. You want to stay active, but overdoing it or even doing the wrong type of exercise can cause injuries or flare-ups. When it comes to work, jobs that require sitting for long periods or repetitive movements can be brutal. Flexible work environments or remote options can make a world of difference. When it comes to socializing, it can also be tough. You might cancel plans because of a pain flare-up or feel like you can't participate in certain activities. This can lead to feelings of isolation or frustration. Let's focus on the positives. What are some of the best strategies to manage symptoms and improve your quality of life? Here are some of the best strategies in my opinion. You gotta tailor your exercise programs. Gentle, low-impact exercises like dynamic neuromuscular stabilization, DNS, which is developmental exercises, and later on, Pilates can help build strength without overstressing your joints. I say later Pilates because exercises like DNS, dynamic neuromuscular stabilization, need to be there to make sure the mechanics of movement are in place before you challenge the body with Pilates moves. Without the proper movement patterns, you will injure yourself and fall in that ongoing circle of no movement and flare-ups. For joint protection, use braces or supports during certain activities, which can prevent injuries. Learn proper mechanics, things like how to lift or sit correctly, can certainly reduce your strain. In my practice, we cover all of that because that is what life is. When you're seeing a rehab clinician that is familiar with hypermobility, understands the challenges, then it's so much easier. They understand you. All the coaching of things that need to happen, or all the exercises, everything will be geared towards your needs. When it comes to pain management, proper movement therapy, which is not just anyone with a license, but the ones who know hypermobility, to help you understand how to move safely, heat or cold therapy, or things like acupuncture will be helpful. Pelvic floor therapy is also something to consider. I have a special passion about this subject because we first need to understand that hypermobility is in all of our joints, with some joints more than others. I can tell you confidently that your pelvis is impacted, and so learning how to stabilize stabilize it is going to be the key to many of your pains, including your SI joint pain, your hip and lower extremity pain, and your lower back pain. What happens in the world of pelvic floor therapy is primarily basically going through the vagina and or anus to address the muscles inside the pelvis. The tendency is to think of pelvic floor issues as sexual dysfunction, pain during intercourse, incontinence, or things like that. Whereas we need to understand that the muscles inside the pelvis are simply behaving according to what's happening too much or not enough on the outside. As long as that's going on there, you are going to have that tightness or weakness that the pelvic floor physical therapist is trying to tackle by going through the vagina or anus. When it comes to pelvic floor therapy and my pelvic floor dysfunction therapy in my practice, I do not even go on the inside. We work on biological breathing and stabilization of the joints, and all of those issues trickle down and get better. Let's move on to prioritizing rest and recovery, because managing fatigue is just as important as managing pain. Listen to your body and don't push through exhaustion. It only makes matters worse. Your diet does matter. I can tell you that this is not a hypermobile thing. It's for everyone. A gut-friendly diet with plenty of fiber and hydration can help manage digestive symptoms, which is so important. Now, if you have sensitivity or allergies, you want to keep that in mind. When it comes to specialist care, working with a rheumatologist, cardiologist, and a physical rehab clinician, that's physical therapists, rehab chiropractors, occupational therapists who are trained and understand hypermobility is so important. Other specialists like primary care doctors or nurse practitioners, those people that understand hypermobility, that is the key. So the first line is someone who understands and treats hypermobility. The second best is those who are interested in learning. Learning with hypermobile EDS can feel lonely at times, but having a strong support system can make all the difference. So when it comes to friends and family, educate them about your condition, help them understand your limitations, and support you better. Some people find joining support groups, whether in person or online, to connect with others who share similar experiences helpful, and it gives them a sense of community that they definitely find comfort in. Having a trusted team of specialists who know your condition and your goals is absolutely invaluable. So ask around, be on the lookout for those providers. EDS is not as rare as they make it to be. Definitely not. I think it's just misdiagnosed or totally missed and disregarded more than anything else. So that's life with hypermobile EDS. And when it comes with challenges, but with the right strategies and support, it is possible to live a fulfilling life. And that's really, at least in my practice, treating patients with hypermobility, that is my goal. If you found this video helpful, don't forget to like and subscribe and share it with someone who might need it. And as always, drop any questions or topics you'd like me to cover in the comments. Thanks for watching, and I'll see you in the next one.